Let's say you are walking down the street. The sun is out, and birds are singing. But suddenly, a person standing right in front of you passes out. What would you do in this situation? Would you continue walking? Or try to help the person from a life-threatening danger? Unless you choose to do the former, it will be useful to learn about an emergency life-saving technique, called cardiopulmonary resuscitation. Cardiopulmonary resuscitation, generally known as CPR, is the most useful first aid technique, practiced by medical personnel as well as untrained bystanders in emergencies including heart attack and drowning. Reliable Medical Association, AHA, is recommending everyone to start CPR process with chest compression. However, it is not completely true. There exist a few more steps prior to carrying out CPR to prevent secondary injuries, along with promoting the faster procedure. Is the surrounding enough safe to prevent additional injuries? Is the person getting CPR conscious or unconscious? If there is more than a person available, make the person contact 911 immediately, while starting the procedure. If a CPR assistance device, AED, is available, follow the instruction given on the screen. If you had already gone through these steps, let's move on to the actual phase. To prevent the confusion, the American Heart Association recommends training programs to use the word CAB to describe an array of CPR sequences. C, here, stands for compression, A for airway, and B for breathing. Reminding people practicing resuscitation in a correct order not only helps them with reducing the life-saving task performance time, but also increases the probability of the patient's survival. Here are the steps of compression. Lay the person found to be unconscious on a firm surface. Sit right next to the person's shoulders, and place the heel of one hand over the patient's chest between both nipples. Place the other hand on the top, make both arms perpendicular to the surface, and keep elbows straight for greater force. Compress straight down on the chest, approximately between 5 to 6 centimeters. Continue exerting pressures until the sign of movement appears, or medical personnel take over the patient. Next is A. Opening the airway. If you have received any form of heart resuscitation education for emergencies, and are confident with the steps, you are allowed to proceed to sequences after C, compression. After performing 30 chest compressions, gently tilt the head back by slightly pushing the forehead with a palm. Then, keep your first hand on the same spot, and bring the other hand to the chin to tilt it forward to make an airway. If the airway is opened, it is now a time to move on to B, breathing. There are two ways of breathing, mouth to mouth and mouth to nose. Mostly, mouth to mouth breathing method is used to provide air. However, for the patients whose mouth is severely injured to be opened, mouth to nose can be the way to inject oxygen through trachea. Here is how we do it. Pinch nostrils to stop air from going out, and cover the receiver's mouth with yours. Give 2 rescue breaths. The first one must last for about a second just to check if the chest rises. If the chest fails to rise and stomach is filled with air instead, go to the previous step, then, try the second breath. If it does rise, you are okay to give the second breath. 30 compressions and 2 breaths are considered as one complete cycle. Each breath must not last for too long, or resumed with too much force. Another cycle must be done to sustain the circulation. If AED is available, attach the device in the chest and follow the instructions. As AED gives a patient an electric shock to reinforce the stable circulation, make sure to stay away from the body while it is in use. Unless medical operators appear to give a hand, Repeat the cycle over and over, till the patient gains consciousness, or paramedics arrive to take him over. Always having the basic concept of how CPR works in mind, will help you with saving somebody else's life in the future. However, keep in mind that the rate of compression and how we provide oxygen differ from the receiver's age.